Can ChatGPT and AI replace your therapist?
Isolation is a key component of people who struggle with depression and anxiety. If we give them a tool that's going to allow them to isolate completely from human touch or even connection, how dangerous that can be. Some of the biggest breakthroughs with patients I have treated have come from the silence.
I'm pretty sure if you're silent with ChatGPT,
nothing happens.
People listening to us right now are going to blow up the comments and say, of course you're against AI therapy because you don't want to lose your job.
I agree.
So why would you ever be in support of this? Because then you're kind of unemployed. Welcome back to another episode of Candid Minds with Dr. T and friends. I'm Dr. Tamir Aldat, addiction psychiatrist, and I'm joined today by my dear friend and colleague, licensed clinical social worker, Jacquelyn Gilde. We have a great episode for you today discussing, can ChatGPT and AI replace your therapist? Now, it's an interesting question. There are solutions such as ChatGPT and Woebot, using various forms of therapeutic techniques to mirror what a session would be like with a therapist. But could it actually entirely replace a therapist is what we're going to discuss. I know how I feel, but we'll see if Jackie agrees or disagrees, and we'll try to reach a resolution by the time this episode is over. Jackie, I'm glad you're here today. What are your thoughts on using AI and solutions like Woebot and ChatGPT as a replacement to go into therapy?
I have a very strong opinion about this, obviously being a therapist. I believe that AI is a great tool for things, but that's exactly what it is. It's a tool. I think it's a dangerous game when people start to utilize it for therapy itself. I think it can give you great feedback. We were talking before that you could literally get yourself into a whole cognitive behavioral therapy session with AI. But there are cues, there's connection, there's different things that comes from having a therapist that therapists are trained in. And so although AI is a tool, it is not a licensed trained clinician. It's not somebody who's been told to look for certain cues. And my greatest grief with it is that AI responds to what you put into it. And so, if I'm saying this is how I'm feeling, it's going to respond to how you're feeling. And it can essentially start a CBT session or any type of session. But a therapist is looking for the things that you're not actually saying. And so for those of you that are in therapy, you know that your therapist is looking for cues. Sometimes you're telling a story and they'll say to you, the way you said that doesn't seem right. What's really going on there? Or you're not making eye contact with me. Are you ashamed of that? And so there's far more to the art of therapy than just entering information and spewing back information. It's the rapport. It's what's built with people. It's the connection that you have with your therapist. It's the cues that a patient has that they might not even know that they have. And so paying attention to those little things are key in breaking through, and I just don't think that AI has that capability. It's not a person. It's not evaluating you in your facial expressions, your body language. It's simply just evaluating the information you've provided to it.
Yeah, no, I've noticed that as well. I mean, there's a lot of unspoken cues that are required to judge a patient holistically. Sure. Pauses suddenly when patients are speaking, nuances in the use of language, particularly when they're using a specific word to describe something, but then they'll use a similar word or a different word to describe something else, trying to understand why they pivoted if they did. I even from my own experience with AI, I don't think it gets that granular in its analysis and stays quite superficial. But like you said, it could certainly be a tool. And I think that tool does have a place when it comes to access. We see patients either being unable to afford therapy, cannot wait weeks to see a therapist, aren't ready to talk about something, maybe they feel judged. And there are scenarios where starting a conversation with AI to begin processing something could be appropriate.
Could be appropriate and also can maybe lead you into therapy or lead you to getting the help that you need. So maybe you were afraid to pick up the phone. Maybe you felt judged. You don't want to actually schedule an appointment and have somebody tell you something. You're not ready for that mirror. but you start to type some things into AI and it starts to give you feedback that then sparks an interest. Well, what's this really mean for me? Maybe I should go speak to somebody. It does, if you go to AI and tell them that you're experiencing suicidal ideation, it does tell you to contact 911. It does tell you the appropriate avenues to get help. And I think that that's a great tool as well. So I think that, for people, we talk about lack of access to care. You created a whole company because of the lack of access to care at Mindful Care, right? And so it's not always easy to get on with a therapist for many different reasons, whether it's a lack of access because of finances or you're just not ready to take that step. That can be that. But the fact of the matter is it can serve as the tool of helping to encourage people get the support that they're in need of. And so we've tested it quite a few times, at Mindful Care, and it does spit back a lot of great information. It does give you a lot of insight. We talked about a couple episodes ago about diagnoses, and you can get a clear understanding of maybe, what a diagnosis looks like and means and what treatment means for it. I just don't think it's the place where you actually receive the treatment. It could be the start. It could give you a lot of knowledgeable information, but I think that that's what it's been created for.
Have you ever used the AI tool and then explored it in a way where you're engaging and it's therapeutic?
I have explored cognitive behavioral therapy with AI. So I've asked it some questions, and then I've also pretended to have certain symptoms to see, actually previous to our episode a couple months ago, where I wanted to see what the internet would give back to me if I looked up certain diagnoses. And so I haven't tried to engage in an actual session, but then I was able to click on it. I put in anxiety and depression. It gave me what those diagnoses meant. And then you're able to click on forms of treatment. And so I did kind of click on that and kind of went through that avenue, but I haven't engaged in an actual conversation where I'm looking for some type of treatment from it.
But you should. I was on a trip, and I found myself out of nowhere just triggered by a specific situation that kept happening on this vacation. And I told myself, I'm curious, if I ask ChatGPT, if you were my therapist, what would you process with me right now to understand why I keep getting triggered by it? And I'm usually a pretty calm guy. I don't usually get triggered. And I'm like, I'm like really getting reactive.
Right.
What would you ask me if you were my therapist and we were doing CBT together? And then it asked me a couple of questions which I thought were pretty thought-provoking. And then I answered them, and I said, well, if we were to process this together, what would you focus on? And we had this kind of back and forth where I was effectively trying to analyze my own situation to understand why am I failing to cognitively reframe, which I'm usually very good at considering it's what I do for other people. I should be able to reframe the situation myself, and I found myself unable to do it. And I ended up using ChatGPT to help me figure out, why am I unable to see the situation any other way than the way that is getting me really frustrated? And it was helpful. I think by the end of it, I was kind of like,
but
it's
you
interesting.
Have the self-awareness. So look at what we do for a living, right? We are very in tune with our emotions, other people's emotions, our feelings. It just comes with what we do. Where other people don't have the self-awareness, so they may not be entering what you were able to enter, if that makes sense. You were able to say, this situation is triggering me. Why? Why is this situation triggering me? If we were in a session right now, what would you do with me, right? Where somebody else they don't have that insight to
where
ask
would they
those
even begin,
questions.
right?
They wouldn't know where to begin. And so there's also times where we know that our patient is telling us just what we want to hear, right? And we're able to confront that, where AI is not going to say, you know what, Tim, you're just telling me what I want to hear. And it can be dangerous because then it's actually not allowing for the individual to really address the concern. It's just addressing what the individual believes is the concern. And I think that that's what's beautiful about therapy is sometimes we go into it thinking we're going to be addressing one thing. I'm coming in because I'm struggling with A. But then when I get there, or you get there and you're working with the therapist, you actually are able to identify that it's actually not what you thought was the problem. It's something else. It brings you down a beautiful journey, a road that allows you to address things that you were just not able to address by yourself because you didn't have that awareness. And so, not to rebuttal, I'm sure it was a great conversation and it was good for you in the moment, but I think it requires a level of self-awareness. You have to know what to feed it, and that's what's crucial.
Have you felt patients are reverting to ChatGPT or AI? Have they told you that they've been using it or exploring it?
They talk about it more in a sense of when they're looking up things. Like, they don't talk about it that they're using it as a therapist. They talk about that they're using it to gain more knowledge about their circumstance. And so I've talked about this several episodes ago, that they really utilize it to gain knowledge of diagnoses, maybe certain forms of treatment, where they can get treatment, how, unique ways of treatment. You know, a lot of people are really into not just that routine therapy anymore. They want to explore different things, which is why microtherapy at Mindful Care has been such a success, because it's not that routine form of therapy. So I think that they're really utilizing it for the knowledge component, but, you know, not that I've heard that they're utilizing it for sessions doesn't mean that they're not, though.
True, and I think it's important for our listeners to appreciate the differences here. So Woebot is one option that people talk about. That's much more of a cognitive behavioral therapy type of solution, much more structured, almost talking about you and understanding why you think the way you think and how that's tied to the way you feel and your behavior. And then ChatGPT is just having a conversation. So think of like a very advanced Google search, constantly going back and forth. That's been the dynamic with ChatGPT. I've actually never used Woebot. I think you have to pay to use Woebot, but I have used ChatGPT, and in that, it just feels like someone who has access to a lot of previously analyzed and reviewed theory, and exploring that and asking it questions and navigating it. But to your point, I think you have to even come prepared to have that conversation. If you can go to therapy unprepared and trust that the process will guide you through whatever you're feeling.
And get something out of it.
Yeah. Even if you can't articulate it. For example, in therapy, creating space for silence is huge and really special. I'm pretty sure if you're silent with ChatGPT,
nothing happens, right? Nothing. And I think that you took the words right out of my mouth. Is some of the biggest breakthroughs with patients I have treated have come from the silence, have come from just sitting with them. It sounds crazy, but you know, you're talking about something and then something stumps them. They sit in this silence, and that's profound. It's profound to be able to sit with somebody in silence and then at the end of it come to this conclusion. And a lot of the times that's what happens. And so if it's silent with ChatGPT, then it's silent. Nothing comes back at you, you know? And so some of the best therapists are able to sit in silence for a very long time. And it's an art. I've had to really learn to hone in on that, because I'm not a silent person.
When you're a rookie, you always need to talk.
Oh, it's so uncomfortable. I think back to the beginning, and I'd be cringing, but I would always just sit in the silence, because that's what you're trained to do. And from that, though, is what did that silence really mean? From the question I've asked you, you've remained silent for quite a period of time. What's going on? What are you feeling? Where are you feeling that? You're not going to get that from AI. And I do love AI. I use it for many different things. I think it could be extremely helpful for clinicians in taking notes and, you know, being able to document efficiently and effectively, and can really change the game for people in the field, because documentation is a huge component. I'm just not sure it's the place where I want people to go for therapy.
Yeah, I feel though like people listening to us right now are going to blow up the comments and say, of course you're against AI therapy because you don't want to lose your job. I agree. So why would you ever be in support of this? Because then you're kind of unemployed. What would you say to those people?
I'd say try both. If you really want to try it, then go to Woebot, pay for it, try it and see if it works for you. But I also encourage you to meet with a therapist as well, and make that decision for yourself. I'm not the say-all be all of therapy. I tell people that all the time. You know, I might be in a role at Mindful Care that, you know, has allowed me to do a lot of great work, but that doesn't make me any more knowledgeable than anybody else. So if you really want to try it and you think it's going to be effective for you, then try it. But I'd also say to try therapy. I also think that Woebot and these things gives somebody a space, though, to live in denial, because part of therapy is confrontation. Part of it is having somebody call you out when you're not able to see what's really going on, or maybe you're behaving in a way that's less than what you should be. And I have not tried Woebot, so I don't know if it will, but I just don't know how AI could do that.
Yeah, I think you lose the power of human connection. And that's that you can't pay for. And we already have lost a lot of human connection, spending most of our day on social media. You go on the subway, everyone's with their head down on their phone. families at dinner and the kids are texting each other when they're sitting at the same dinner table. So to chip away at human connection even further, when therapy is supposed to be navigating your feelings and your thoughts and seeing what true empathy is like, even empathy with ChatGPT is artificial, right? So I would say, if I had to give advice to our listeners, is it is a tool, like you said in the beginning, and it could really help the early preliminary
the
processing
stage.
Yeah.
I'm contemplating if maybe I should go get some help or get therapy. I think it could be key there. Yeah. I know it can, but to take a session there. And to answer your question, sorry to cut you off, is that of course I believe in certain things. I'm a therapist. I got trained, and I want to help people for a reason. But I also throughout the years have learned what really helps with people. And so isolation is a key component of people who struggle with depression and anxiety. If we give them a tool that's going to allow them to isolate completely from human touch or even connection, how dangerous that can be. And so I can't tell you how many people come to sessions who don't talk to people throughout their week, who do not connect with people throughout the week. And the only person that they're connecting with is their therapist. So now there's somebody who has eyes and ears on this individual to make sure that they're safe, to make sure that they're okay, but also that that's the only form of connection that they're getting throughout their day for all of their days. And how crucial that could be for an individual who now decides, well, I'm going to try this. There's no connection at all then.
Absolutely. And I think even to bridge between sessions, if you want to process something with ChatGPT and say, I want to bring this to therapy this week, this is kind of where my head's at, clean up kind of those thoughts a little bit so you're more prepared to speak to them, that certainly could be appropriate as well.
I actually love that. I think that could be a great tool to preparing. Sometimes people get overwhelmed coming to session because they have so much they want to share. So I think utilizing it in that way really could help organize your thoughts so that you get the most out of your session.
Absolutely. Absolutely. And ultimately, I would advise our listeners that there is no replacement to human connection, to the accountability that comes with going to a therapist. It's unusual for ChatGPT to challenge you, right, and tell you that's not really how you feel. I mean, I've never encountered that where it would disagree with me if I tell it I'm getting triggered and be like, no, you're not. That would be very awkward, right? So the accountability that comes with therapy and the expertise. I don't think the nuances, like you said, in terms of social cues, body language,
terminology, words. A large part of therapy is also redefining. And so sometimes somebody is using one thing to define how they're feeling, and the therapist is actually able to say, actually, that word is not actually explaining how you're feeling. This is. The bot is not going to be able to do that. They're not going to be able to sit with you and say, no, this is how you feel, as you were saying. This is the correct terminology for how you're feeling.
100%. Well, Jackie and our listeners, thank you very much for joining us. This was an informative and great conversation regarding AI and therapy. Tune in for more next time.